primarily, we become afraid to talk about these experiences largely out of sensitivity or concern that we can't relate to their experiences. What we universally know is that simply just acknowledging the fact that racism exists, and historical inequity exists, within the context of a safe and supportive relationship with your patient is empowering. It's supportive. Oftentimes as African Americans, we are told that these experiences don't exist, that we're imagining these experiences or that they're not that harmful at all. And what we know from research is that just the perception of discrimination has impacts on one's mental health and even their physical health across the life course. And so one big encouragement that I have for any provider is just being comfortable and allowing yourself to have that conversation when things come up with your patients. It doesn't mean that you necessarily have to engage every patient every time an incident happens. But certainly if your patients are bringing up these experiences, talking about the potential for them causing stress, it means that they want to talk to you about it, and it means that they're concerned about it. And so using our power as a physician and our skills as a physician to have these conversations in a culturally sensitive and supportive way, I think can actually be healing for our families. There's a process called racial socialization, and it's one of the sort of unwritten steps in African American families by which fathers or mothers prepare their young kids for living and existing in a world that's in which racism exists. They talk with them about ways they can be safe and they can protect themselves in terms of their engagement with police officers. It's done out of this idea that you don't want your child to be victimized or brutalized by police or in any other setting. But we can certainly make sure that the dads and the moms feel supported and aware and have the right language that they need to have these discussions. So I think the biggest thing that we can do for any of these issues as pediatric practitioners and providers is just be open, right? And to understand where our strengths are and where we just have a role in facilitating and supporting and encouraging our families. Currently, there exists an array of different interventions and programs that are trauma-informed and designed to either mitigate the impact of trauma on kids or prevent exposure outright. But what I'm consistently seeing is that one group or organization is doing some very interesting and innovative work that other groups who are like-minded are not aware of. And so I think that one of the major benefits of Pathways to Resilience is this opportunity to really share across our country and to share across different networks. One of the things that is happening is that you have folks who are in the academic world who are working to build trauma-informed practices, while we are also doing the same thing in the healthcare world. And we think that we're so different that we can't offer any guidance to each other, and I think that's not true. That there are clear lessons learned that we can share. There are clearly identical programs that we can actually work to collaborate on. And so I think on the ground level, on the practical level, I think there's going to be an opportunity for sharing of information and resources and knowledge that will help really accelerate the work. I think also the fact that policy leaders are going to be engaged in this work, there'll be opportunity for figuring out ways that we can create legislation and financial support to continue to work moving forward.